Hey guys, it's Callie and welcome back to another video. If you guys are new here, hi, my name is Callie and I am a first semester nursing student, about to be a second semester nursing student pretty soon here. And I make videos related to nursing school or college in general. And in this video, I'm going to be taking you guys along with me through another week in my life as a nursing student. So I'm going to be taking you guys along with me this week as I take my third patho exam, my third patient-centered care exam, and I also have my subcutaneous and intramuscular injections validation this week. So I'm getting validated on that. So that's essentially like passing a test in our lab class. So once you're validated on that, you can do that in the clinical setting, which is really cool. So starting next semester, I'll be able to do that. And then I also have my last day of clinical this week too. So I'll be taking you guys along with me through all of that fun stuff. So I hope you guys enjoyed the video, and without further ado, let's get into it. Hey guys, so it's currently Sunday, November 12th, and I am studying for my third patho exam. Right now, it's our last patho exam before our final, and I want to be real with you guys, and I don't always want to show like the best parts of nursing school and just the highlights of it. I also want to show like the harder parts of it and the reality of it, which is that sometimes, like this weekend, you don't manage your time very well and you find yourself cram studying like I am right now. But I am filming a week in the life this week, so I wanted to pop on here and just give you guys a little update of what I'm doing right now. So I'm currently finishing my last Quizlet for this patho exam. I make a Quizlet on every single PowerPoint and then I study all of them for the exam. So this one is on 4 chapters and I've finished 3 out of 4 of those. I still have to finish one more. It's 6 p.m. and I take the exam tomorrow morning at 8 a.m. So I really don't have a lot of time right now. I really didn't manage my time very well and I'm very stressed at the moment. I'm trying not to have a mental breakdown, but it's okay. We're gonna just hope for the best, I guess. I've never waited this long to study and finish my Quizlets before a patho exam. So we're gonna see how this goes. But I will update you guys on how the exam goes tomorrow and what grade I get. And yeah, I will see you guys on the other side. Also, just to give you guys a visual, this is my Quizlet here. So it's our third exam. So all 3 of these are the Quizlet sets that I've made. So our third exam is on gastrointestinal function, the urinary system, and reproductive function. So it's actually 3 chapters, not 4, my bad. But yeah, so I'm just currently finishing this one right now. I'm currently at card number 194, so there's going to be a lot in this set because I still have about 30 more slides to go through. But yeah, so I just make one on each chapter. And yeah, that's pretty much it, and that's how I study for every exam. Hey guys, I look super rough right now, okay, but I wanted to update you on how the patho exam went. I just took it, it's done. I don't think it went the best, but we did get our grades back immediately, and I'm just gonna wait for them to do analysis and everything later, probably sometime today or tomorrow, for them to officially post everyone's grades, to tell you guys what I got. It wasn't bad. It wasn't as good as the other exams, but I didn't manage my time well at all. I really should have started studying sooner and just not putting it off. But overall, like, I'm still happy. Like, it wasn't a bad grade. Okay, I'm sorry for the jump scare, but I'm editing the video right now and I noticed I never gave you guys my grade for the patho exam. So I wound up getting an 85, or an 86 depending on how you round it, because it was like an 85.8 or something. But yeah, so it wasn't the worst. It was still a good grade. I'm still really happy about it, but it did show that, like, okay, I could have definitely tried harder, because the first 2 exams I did really well. I got 99 and a 98, and then on the third exam I got an 85. So big difference. I need to manage my time better. especially for the final exam. But yeah, I just wanted to pop on here and tell you guys because I figured it wasn't fair to just not let you guys know and leave you hanging. So anyway, without further ado, back to the video. And now we're gonna get some Dunkin' because I really need coffee. It's gonna be a long day because I still have my PCC class after this, and then I'm going to the gym with my boyfriend, and then we're probably gonna hang out after that, do something else. So it's just gonna be a long day, and then I don't know, maybe later tonight I'll do some studying. I have my health assessment lab tomorrow, and we're gonna be practicing our BAT, I believe, because all we've been doing the past couple weeks is just practicing for that, because that's our like final exam in lab. And what it is, it stands for bedside assessment tool. So it's basically, it's a 20-minute video that you have to record of you performing like all of the assessments from head to toe on a person. So it's just you demonstrating that you know how to do your cardiac assessment, your pain assessment, which is like old carts, you know, your abdomen assessment, GU assessment, like everything. So we're probably gonna work on that tomorrow. But yeah, we're gonna get some coffee right now because I'm really tired. I got like 4 hours of sleep last night, so I really need it. And then as like a reward for taking an exam today, because it's exam day, I really want to get like the brown sugar cookie latte that they have with the cookie butter foam on top, because it's back in season for the holidays and I love it so much. It's so good, you guys. It's like really sweet, but it's like, oh, it's so good. So I'm gonna get that, and then I'll probably see you guys sometime later, or if not, then sometime tomorrow. Okay, you guys are getting propped on my door because my little, this little phone mount that I got from Five Below, to hold my phone while recording on my dashboard, it doesn't work anymore. It lost its sticky, so I need to get a new one. But anyway, I think the last time I saw you guys was on Monday, after my patho exam. So today is Wednesday, and I just got out of lab. I just had PCC lab, and we had our subcutaneous and intramuscular injections validation today. So at my school, like our validations, basically that's like an exam in lab, sort of. It's like you perform a skill, and then based on your performance determines if you pass or you fail, sort of thing. I was kind of nervous for this one. I wasn't super nervous compared to the Foley one that we had to do like a month ago, for Foley catheter insertion. That one I was a lot more nervous for because there's a lot of steps to that. But this was more about memorizing like the sites for intramuscular and subcutaneous injections, the size of the needles that you use for both of those, the gauge range for the needles as well. So like for intramuscular, it's 21 to 23 gauges. For subcutaneous, the gauge range is from 25 to 30. And then you had to memorize, you know, like all the different places. So I had to explain to my instructor during the validation, like how to locate the deltoid area where you would administer an intramuscular injection. So for deltoid, it would be like you locate the acromion process. It's 2 finger lengths below the acromion process. You make a V, you go in between, and then we had to do ventrogluteal and vastus lateralis. Anyway, so for the validation, it was fine. It went well. I was pretty nervous like during it, but it actually wasn't too bad, and I passed. So that is everything for my PCC class for semester 1, guys. I'm all done with my PCC lab for semester 1, not class, sorry. So now I just have to do my BAT or the BAT for my health assessment lab, and then that's it for my labs. And then we have one more exam in PCC class this coming Monday, and then it's just finals after that, final exams, and then we're done. And it's really crazy because I feel like this semester has gone by so fast. Like, the fact that I'm already done with my first semester of nursing school is so crazy. And then I'm going to be a level 2 student next semester at my school. Based on the semester you're in, they call you like level 1, level 2. It's by like level. But yeah, that's like so exciting, guys. I'm so like, it's so close. But yeah, anyway, I wanted to update you guys on that and then give you guys like a recap of what happened yesterday because I didn't really film much yesterday. Yesterday I had my health assessment lab, and we did OB in lab yesterday, which was really fun. So one of our teachers is actually very pregnant. She's like due to have her baby in literally like 2 or 3 weeks. Like her due date was actually on our final exam day. Like, that's how close she is. Like, and so our lab instructor, she used to be an OB nurse, so she performed like an assessment on our teacher in lab yesterday, like how you would measure like from the symphysis pubis to the fundus, something like that. So she showed that, and then she was showing like the Doppler, like she found like our instructor's baby's heartbeat, and it was just like, it was so cool. And then the instructor who's pregnant, she's a peds nurse, like that's her specialty, and so she was like talking to us about some of the things that they do in peds, just giving us like a little introduction to peds, because we don't do peds in OB until our 3rd semester. So that's when I'll be a level 3 student. That's when we have our OB and peds rotations and our clinicals. I'm so excited for that, but it's not for like another like half a year basically. But yeah, so that's what we did in lab yesterday, and that was super cool because I love like babies, and I think that I really want to be like a NICU nurse, or definitely like something along the lines of like peds, labor and delivery, something with tiny humans. But anyway, that's basically yesterday. That was what we did in lab. And then after that, you know, I showed clips. I was cleaning up my room because it was like a mess, and then I always just feel better after I clean, and I just have like an organized, like nice space. And then I just worked on some assignments, and yeah, so now I'm just gonna do some schoolwork. Our PCC exam that I mentioned earlier is on Monday, so I'm probably gonna I already started my Quizlet for that exam, so I'm probably just gonna be going through and adding more stuff to that. And then we have our last day of clinical on Saturday, guys, and then we're doing Friendsgiving after clinical, so I'm excited to show you guys that. I think it'll be a lot of fun. And then I think on Friday I'm gonna record my BAT with my friend because we both need to do it. So maybe like I'll get some clips to show you guys that. That's my little update for you guys. Hopefully I get some good studying done today. I'm really tired. I'm hoping I don't take a nap. I was so tired this morning. I was gonna take a nap after lab, but then I was like, no, I shouldn't, because I don't know if this affects any of you guys, but I know that like me and my friend were talking about it because she was saying it happens to her too. But when I take a nap, I have a hard time, like in the middle of the day, I have a hard time going to bed later that night. So then it's kind of like a endless loop effect sort of thing where like, okay, so I took a nap because I was so tired today. Then I stay up late because I took a nap. So then because I stayed up late the next morning, I'm really tired again because I had to wake up early, and then I have to take a nap. You know what I mean? So I try not to take naps. So I got coffee to hold me over. We'll see if it does, but yeah, I'm going to try to grind today, get some studying done because I need to for that exam I have on Monday. And yeah, I'll see you guys in a little bit. guys, today is Thursday and I'm currently driving to my boyfriend's right now. We're supposed to go to Armature Works, which is this place in downtown Tampa here that I've never been to before, so I'm super excited to go there with him, and I'll try to get some footage of that for you guys. So it's Saturday night after clinical. It's 5:21 right now, and I'm on my way to my friend's place for Friendsgiving because all of my nursing school friends are doing Friendsgiving together tonight, which is super fun. I've always wanted to do a Friendsgiving. So I'm bringing green bean casserole and sweet potato casserole, and I did not cook it, but I'm hoping it's good. It's from Publix. It's one of the pre-made ones that you just heat in the oven for like half an hour. But yeah, clinical today was good. It was our last clinical of level 1, which is super crazy. And I got put in the ER today, which was really cool. So I got to experience that, and like the nurses that we were with were super nice, and one of them like set up this whole like IV line thingy for us to practice IVs, which was really nice of her, and it was really fun. And then one of the nurses also volunteered for the other nurse to practice, or to put an IV in him to show us for practice, which was super nice of him. Like, that was so cool that he just offered himself like for the students to watch, like get an IV put in his arm. Okay, I'm here, and I would update you guys some more on my clinical today, but I don't really have time right now because I gotta go. But I will see you guys in a little bit after Friendsgiving.
Oh God.
It's gonna fall. Told you.
There we go. Hello, ladies and gentlemen. We just got back from a Friendsgiving, and we're very full. We all loved Callie's dish that she made for
so good.
All of us.
Yeah, everyone totally like didn't make fun of it and call it like
it wasn't
spiceless,
seasonless.
seasonless. Yeah.
But I mean, everyone loved my homemade cheesecake.
You know what? I would have taken it more personally if I'd cooked it, but it was Publix.
Oh,
okay.
Wait, I forgot. I left the cheesecake with Sophia because
Hey guys, it's Sunday. Friendsgiving yesterday was so much fun. I completely forgot to get clips for you guys. I'm sorry, but I'll insert like a picture right here because of like the food and stuff, because the food was really good. Everyone brought something. It was kind of like a potluck sort of thing. So like someone brought like homemade mac and cheese, and someone brought like homemade like buffalo dip and chips, and I brought like my green bean casserole and the sweet potato casserole, and it wasn't the best, but it's okay. I just took the rest home and I'll just eat it here. And then the main dish was like pulled pork, because we weren't doing like a traditional Thanksgiving because we had clinical, so we needed like something that could be made in like the slow cooker, and that turned out really good with like barbecue sauce. I think that was like my favorite thing last night was the pulled pork. It was so good. But anyway, that was a lot of fun with everyone. And now today I'm gonna spend the entire day studying for my 3rd PCC exam because I still need to finish one of my Quizlets for that. The exam tomorrow is on stress, skin integrity, and medication administration, and I have my stress and skin integrity Quizlets done, but a lot of the exam is on medication administration and dosage calculation. We had our dosage calculation exam last week or 2 weeks ago, but we just had it, and I was really, really nervous for it because we had to get at least 85% or higher in order to stay like in the program. And if you didn't score, then you'd have to go into remediation if you didn't score that high. But luckily I only missed one. I was really, really nervous for dosage calculation, but it went well. So I was really happy about that. But anyway, we have more dosage calc questions tomorrow on our exam tomorrow. So I need to refresh that, like that math in my head. I need to practice some more dosage calc just to make sure that I still have it like in my head. I still know how to do it, and I haven't forgotten anything. And yeah, and then I'm just gonna study my Quizlets after I finish the medication administration one. But yeah, I need some coffee, so we're gonna go to Dunkin'. And then I'm gonna go to the library. I haven't been to the library in a little bit and I really miss it, so we're gonna go there today. It's like so late, guys. Like it's literally, I'm not even kidding you, it's 3:30 right now. I slept so late today because I've been struggling with like sleep lately more than usual. Just with clinicals, I've been having a hard time like catching up on sleep because during the first like 8 weeks in nursing school, I would come home on the weekends and catch up on all my sleep because I didn't have to be up early. But now my clinicals are on Saturdays, so I have to get up at 4:30 to like 5 in the morning, and that's just like super early, and so it messes up me catching up on sleep because then Saturday night after clinical I'm so tired. So like today is Sunday, so I slept in like so late today, and then tomorrow morning I have to be up at 8 a.m. but I know I'm not going to go to sleep for a while because I slept in so late today. So I'm going to be tired Monday night, and then I'm going to sleep in like so late on Tuesday before my 1:30 lab. You know what I mean? It's just I'm having a hard time like juggling, balancing nursing school and getting enough sleep, and just like my schedule overall. Like I have a hard time getting up and going to bed at the same time every single day, but it's something I'm working on, and next semester I really want to get like a solid routine down and really stick to it. So I'm going to work on that more next semester, but we have 3 weeks left of this one, which is insane. This one went by so fast. But yeah, finals week is the week after next one. I'm gonna have to start studying for that soon, and I'm pretty nervous because all of our finals are cumulative. But it should be okay as long as I study and I manage my time well. But yeah, we're gonna go get some coffee, we're gonna go to the library, and we're gonna have a good, productive day, and we're gonna do amazing on our PCC exam tomorrow. So I'll see you guys sometime later. Hey guys, it's Tuesday night. I'm about to end the vlog, but my PCC exam grades just got posted, and I figured, I've never done this before, but I figured I would open my grade live on camera for you guys, because I took you guys along with me as I was studying and everything this week, so I figured it's only fair to open it with you guys and tell you what I got. So it could be really good, I'm not really sure. With PCC exams, I never really know how I did after, but even if I didn't do the best, I still want to be real with you guys and not only show you the best parts of nursing school. So I'm about to open it and we're gonna see what I got. I'm really nervous, but all right, here we go. Okay, I got a 91%. I will take that. I am happy with that. So I'm happy with that. It brought my grade to a 90% in the class. So I still just have my final exam, and that's it for this class. And that's right on the edge of an A and a B. So that's kind of freaky because, you know, like it would really suck if like the last exam drops me below an A to a B, but at the same time, I'm just thankful and happy to be passing all of my classes. Nursing school is hard, especially this is my first semester, and I'm just thankful that I've gotten through it and that I've made it this far. And I'm immensely proud of myself for making it this far and for even having done as well as I have done. So whatever the case is, come final exam time, I'm still going to be proud of myself, and I'm still going to be really happy with what I get, as long as I pass, of course. But I think that's about everything for this vlog. I think this was a little bit longer than my usual week in the life videos, but it was a really busy week. A lot happened. I think I took a patho exam, I had my medication administration check off, had Friendsgiving, I had clinical, I took this PCC exam. Like, a lot happened this week, so it's been a busy week. But thank you guys so much for watching this video. I really hope you guys enjoyed watching it, and if you did, please make sure to give it a like and to subscribe for more videos from me in the future, because this is only the beginning of my nursing journey and I plan to make a lot more videos for you guys. So stay tuned and I will see you guys in the next video.